Thank you for joining us today on our talk for Abnormal Mammogram, What's Next? I'm Dr. Rachel Shirley. I'm a breast surgeon at Comprehensive Cancer here in Summerlin in Las Vegas, Nevada. And I just wanted to present a couple of things that I get asked a lot about for mammograms. I know we don't talk about things beyond screening a lot of times, so I wanted to give that information. The first question I get is, when should you start your screening mammograms? This is something that you should be in conversation with your doctor about, and it takes into account the fact if you have any family history or have any reason to have a high risk for breast cancer. That may mean that you need to move your screening mammograms early. The American Society of Breast Surgeons recommends starting screening mammograms at the age of 40 and considering doing them annually. But this may be different for you if you have a different risk. Screening mammograms are ordered when you have no symptoms. What can a mammogram tell me? One of the things that mammograms can tell you are how dense are your breasts. Also, do you have calcifications within your breast? Are they benign, meaning not cancer, or are they concerning, for which you would need a biopsy to tell you if they are concerning or not concerning? They can also tell you if there is a lump in your breast that would be described as a mass, or if there is something on one side that isn't on another side, which is called an asymmetry. Here is a picture of the 4 different types of dense breast. Type A occurs in 10% of women. This is the easiest to find new changes in mammograms, as the breasts are almost entirely fatty. Type B, you can start to see a little bit of density, and about 40% of women have type B. These are considered mostly fatty breasts, though. Type C is when we consider women to have dense breast tissue. This makes it difficult to see some new masses, but about 40% of women will have type C, or heterogeneously dense breast tissue. It's important to know how dense your breasts are, because as they become more dense, it does increase your risk of breast cancer in your lifetime. Type D is the most difficult type to find new changes. This is the extremely dense breast. This is present in 10% of women. If you have type C or type D breast tissue or dense breast tissue, I would consider looking for a 3D mammogram as part of your screening. This can tell new changes more easily compared to the traditional mammogram. Also, it decreases the chance that you'll have to go back for additional pictures, as it can see things more clearly. You should check with your imaging center as well as your insurance company prior to getting the 3D mammogram, as it may cost more money than your traditional screening mammogram. One of the things mammograms can see very well are for calcifications. Calcifications can be normal changes in the breast and can occur as we age. Not all calcium is bad. Also, calcifications in the breast are not caused by calcium in the diet. These are just a few pictures of benign or non-cancer appearing calcifications. In comparison, this is a picture of a cancer-causing calcification. This is seen in early types of cancers and is often only seen on mammogram. Most people cannot feel this type of calcification and would not be able to detect this just by self-breast exam. This is one of the important reasons why we get mammograms. These types of calcifications occur in groups, are different shapes and sizes, and tend to be smaller than the calcifications seen in benign or non-cancer. This type of calcification often requires a special type of biopsy called a stereotactic biopsy. This is when we use the mammogram machine to help find the calcium in order to get the biopsy. Another good use for a mammogram is to find new masses. Here on the right, you can see a normal breast, whereas on the left, there's a new white mass. This is something that can clearly show up on a mammogram and would be a reason to get more pictures. Often when there is a mass found on mammogram, the recommendation is for an ultrasound. Ultrasound can tell us the difference between concerning masses and normal things like cysts. A concerning mass has jagged edges, it's darker on the inside, and has a shadow below it, whereas a cyst is nice and round but has a bright shadow below it. A cyst is something that can be watched, whereas a concerning mass like this would need a biopsy. If I've just gotten a mammogram, why do I need another mammogram and ultrasound? This is so we can look at the area more closely. The mammogram the second time around will focus in on the area that was identified on the original mammogram, and the ultrasound will be able to help tell if this is something that we can watch or if this is something that we need a biopsy for. Sometimes we get mammograms and we just watch it. Why do we have to wait 6 months to watch it? When something is given a 6-month wait period, it means that it's not likely to be cancer. In fact, 98% of the things that we watch over 6 months do not end up being cancer, which is why we don't just take them out. Only 2% of them will end up being cancer if we watch them for a total of 2 years. If I feel a lump, can I just get my normal mammogram? No, this is something that you need to talk to your doctor about because they'll want to order a mammogram that's special and focused in on the mass as well as an ultrasound. So it's really important that if you are feeling changes, that you tell your doctor so that you can get the right type of mammogram for you. Can a cyst or a fibroadenoma ever become cancer if I leave it in? The answer to that is no. The cyst itself does not become cancer, nor does a fibroadenoma. However, you can have new changes. So just because you've had something normal in the past doesn't mean that you can't develop something new. So any changes are important to tell your doctor. I'm having a biopsy. What can I expect? There are several different types of biopsies, but the two most common are under ultrasound or under mammogram. A biopsy under ultrasound can be done in a breast surgeon's office or in the radiologist's center. This is done with you awake, but in a comfortable position where we give you local medicine to help stop the pain. A couple of pieces of the mass will be taken and sent off to the pathologist to determine if it's benign or cancer. Also, a special marker will be placed inside the breast, and that's so that we can find it in the future. A mammogram or stereotactic biopsy is done in the radiologist office. This is done where a mammogram takes a picture, and while you're laying on your stomach, then they can take pieces. There are also special mammogram machines where this can be done in the seated position. Why am I having a biopsy? There are several different reasons to have a biopsy. Anytime something is new on the mammogram, or you're feeling a mass, or if there are new calciums on your mammogram, this would be a reason why you might have to have a biopsy. We want to make sure that this is not cancer developing, and the biopsy tells us if this is something safe to watch or if this is something that needs to be treated. If your results come back abnormal, what do you do? This is the time to see the breast surgeon. The breast surgeon will help guide you through what the next steps are, whether that's surgery or medication, or maybe even a combination of both. So it's really important to get with a breast surgeon at the time that you have abnormal results so that they can go over those results and help guide you on which way to go. Thank you for your attention during this time. If you have any questions, I'd be happy to answer any.